Welcome to the Office of Learning Services workshop on Succeeding with ADHD, Part 4. This will be our final part of this presentation. This section deals with assessment. How do we evaluate ADHD? We look at current concerns through client and parent interviews, history through clinical interview regarding the concerns, and differential diagnosis, which means that we have to look at all of the information and determine whether or not a different diagnosis would be more appropriate, such as anxiety, depression, etc. We use broadband rating scales, such as the Child Behavior Checklist, which is appropriate for students in the K through 12 system, behavioral assessment system for children, that is also used in this setting, Barkley ADHD rating scales, and the brief or brief A, continuous performance tests, and other tests of attention. Treatment of ADHD. An effective treatment would require one to pay attention to all of these components. A treatment would first require careful diagnosis by a qualified professional. Those professionals include clinical psychologists, school psychologists, educational psychologists, neuropsychologists, psychiatrists, physicians, developmental pediatricians, and other individuals. The second step is to educate the person about the nature of the disorder in order to be better able to understand themselves, which will inevitably reduce the frustration, anger, and lower self-esteem associated with the disorder. Give serious consideration to the use of medication. Medications are among the most effective treatments for the management of ADHD symptoms. At least 3 classes of medications exist. Some are stimulants, some are short-acting, long-acting, some are used for multiple disorders. Between 65% and 92% of individuals respond to one of these medications. The degree of improvement is greater than for many other psychiatric drugs. Medications are effective when used as prescribed. Greatest problems with medications are consumer acceptability, availability, affordability, and non-adherence. You may hear a lot of information, both negative and positive, about some of the medications for ADHD, such as Ritalin. Ritalin is one of the most researched drug for ADHD and is also one of the best acting drugs. However, there are many additional drugs that are useful for individuals with ADHD that don't have the growth concern that Ritalin has for young children, such as Strattera, Vyvanse, Focalin. This improved inhibition will boost the individual's ability to resist the urge to act, stop responding midstream, withstand distraction. This improvement will also help improve the individual's executive abilities, help improve self-controlled behavior. Modifying environments. The main problem is impaired sense of time in which the individual is unable to use the past and the present to anticipate the future. Tasks must be structured so that there is little delay between individuals' responses and the outcome of responses. When this happens, people have little or no difficulty performing well. Performance is impaired if the time between responses and outcome of those responses is long. So think about a child's classroom where there is a lot of wait time between transitioning from math, for example, to social studies. These individuals have difficulty during these long wait time periods. Another example is a 2-month assignment. The tasks may be broken down into smaller units and rewards provided for positive outcomes. This theory suggests that important information be placed at the point of performance so that individuals will be aware of what they are involved in. They require more external support and guidance for their behavior because they cannot do that for themselves internally. External sources of motivation should also be provided at the point of performance. Artificial rewards could be provided which the child earns by resolving a problem, such as token rewards which could be exchanged for gifts. Physical forms of information should be provided so that they can manipulate these informational tools to solve problems. This is because they are more attracted to physical forms of information. You could also find a coach or mentor, tape record important lectures in class, schedule hard classes in the morning, get written syllabi as handouts, require continuous note-taking to pay attention to lectures or during reading assignments, peer tutoring, and studying with a buddy after class. Conclusion: ADHD is a disorder which currently has no cure. Treatments need to be maintained because if they are withdrawn, the individual's functioning normally declines sharply. If a sound treatment program is maintained, people can make meaningful contributions and they can live their lives to the fullest of their abilities. Living well with this condition requires the understanding, support, and love of those closest to the individual with the disorder. Remember, these individuals are often put upon by teachers and parents and friends who notice their distractibility and sometimes frustration and other out of control behaviors, which make them feel sad at times. Please keep this in mind when working with this population. We have to know that understanding of the disorder is the best way of helping people with the disorder maximize their potential. Thank you for your kind attention, and I hope that you will return to one of our other workshops.